Today I'd like to talk about kids' eye exams. And I'll start by saying I start really young with kids. I like to see kids when they're 6 months of age or older. So if you have a child that is older than 6 months and they have not yet had an eye exam, I would recommend seeing that child as soon as you can get them in. The reason is because small problems can be solved when they're really young that can't be solved when they're older. And so I like to start early. And there are also things that, other than an eye professional, that other professionals won't pick up. So when I'm looking at a child, a couple of the things that I'm looking for. One is, are the eyes straight ahead? Are they even? And I should add that when I'm doing this, I use this little scope. This is called an ophthalmoscope, and when I shine this at a patient's eyes, I look at how it reflects back at me, and I can really easily tell if the eyes are straight. Also, when it reflects back at me, both eyes should be about the same. And when I'm doing this, it's a lot like the red eye reflex you get with the camera. And so, in fact, if you go look at photos of your child and see that there's the eyes, one eye might be brighter than the other, if that is true, bring that photo with you. And it also might motivate you a little more to have a professional look. It might be nothing, but it also might be a problem that can be fixed. Two, unlike with adults, I don't go through the whole what's better, one or two with a child. They're not vocal. They can't do it. They can't tell you that one of their eyes is blurry because they don't know any better. They're not going to take the time to check their right eye and their left eye. They just know what they see, and they don't know any different. And so they don't know it's bad until you show them what's good. In which case, I have what's called a retinoscope. Now with this, I can use this on anybody, but I almost always use it with kids, always use it with kids actually, where I measure their prescription. If the child does happen to be vocal, this one really actually helps me to know if they're lying to me, because I can really get to the point where I can make most people see 20/20 with just this little guy right here. When I'm doing an eye exam, of course, there's also the health exam. I dilate the patient, and the dilation also helps me refine the prescription afterwards. But we look inside the eyes, and I can see inside the eye, look at the retinas and the optic nerves much more thoroughly than any other medical professional, just because the eye is dilated. And that's something that I highly recommend. If you know your child hasn't been in yet, let's just look and make sure that the little things are okay, so that in the future they have the best chance for success and good vision.